My name is Patricia Darnauer. I'm a proud Army veteran. I've served for 29 years in the military, and now I'm the Senior Vice President of Support Services at the Harris Health System. So I joined the military through the ROTC program. I was looking for a way to fund college when I was coming out of high school. My most memorable and probably my most rewarding experience was when I had the opportunity to command a deployable combat support hospital, basically a tented trauma hospital in Afghanistan in 2011. It was a very worthy mission in some very difficult times, but the esprit, all those things you hear about people talk when they're in the military, that camaraderie and that focus on mission, that was probably the culminating opportunity to experience that in my career. Right, so for any veteran looking to transition, they always tell you to take a full year in advance. Most of us are so busy doing our day-to-day job that we don't take advantage of that, and I was one of those people. Unlike some folks, my skills were pretty transferable to the civilian sector. Health administration was pretty comparable in both environments. But it was a bit of a difficult transition. The military has programs that help you prepare, but unless you're going to a hometown where you know folks, it can be frustrating to try to establish yourself in a new community. Before I came out, I looked for mentors that could assist me and maybe help had already gone through that scenario, and how could I benefit from that. I reached out to some former veterans who were in the Houston area and made connections through them, and then found assets in the TMC as well, and then through other veterans organizations. It was not a quick process. Even with a master's degree, it still took me several months. I spent about 7 months looking for a job, and before I landed happily at Harris Health System. I did. Last year I participated in their Red, White, and You job fair in a panel discussion. They reached out to help veterans translate their military career into civilian resumes. I reached out to a vet association called Next Op Vets. That's located here in Houston, and they're magnificent. They've created relationships with many of the talent acquisition managers in not only the healthcare industry, but in oil and gas and the energy, and really help make sure that you could have your resume at least be considered. They, no guarantees of a job, of course, but at least figure out a way to have it rise above the masses of applications that acquisition managers are going through to fill any given job. Houston's a vibrant community, but it's still competitive. The surprise was the challenge with just understanding job titles. In the military, you start with rank on your shoulder and a duty title, and you go through the military, and those are pretty consistent. When I was first transitioning, even looking at applications, it was hard for me to figure out what level of a position was this in a given organization. And so having an organization like Next Op or like assets here in the TMC or Texas Workforce Solutions help you through that is really significant. I didn't know if I was applying in some cases to almost a secretarial level or a senior level executive position. And so that was a little bit of a surprise. Once you get through, I'd say Harris Health has that same values driven, that same mission focus. That part of the transition was pretty good. I mentioned that my specific career field is pretty comparable, but I would say more than that, for any veteran that's looking to transition, those values that you learn in the military, that you come to aspire to, whether you have to internalize them if you stay for 4 years, 8 years, or 29 years. Those translate well. I think employers anywhere are looking for folks that are dedicated, that are going to show up to work on time, that understand what hard work is and what it feels like to be successful at the end of the day. And a lot of that you learned in the military, and so those are things that have been really comfortable for me. We have the opportunity at Harris Health System to partner with both Baylor College of Medicine and UT. So we have opportunities to learn and integrate some of the best from both of those schools. We train and grow the next generation of medical leaders, but even more importantly, the vibrancy is in taking the research, taking the hard work of our nursing staff, our administrative staff, our physician partner staff to deliver on that healthcare mission in Houston. And that's a privilege that I think most of our staff recognize. So we've got about 9,000 staff members spread out across Harris County. And, you know, what really drew me or has enticed me even more after I came on board with Harris Health is that, you know, these nurses, Houston is still a competitive market for nursing, right?
Very much so.
Well, these nurses, you know, they drive by other hospital systems to come take care of our patients. And if I can do anything to help make their jobs easier, that alone is rewarding. So that for me has been the most exciting part of becoming part of Harris Health and seeing what we can do to better the overall health status of the community.